My name's Conor, and in a similar vein to the last talk, I'm going to speak about the environmental impact of spine surgery and ways it can be reduced. I have no declarations to make, and this talk is just a summary about a paper that was published late last year in Spine. So as a background, the climate crisis is becoming increasingly obvious in our day-to-day lives. Last year, there was a number of high-profile wildfires in Greece and California, which signify a greater prevalence of extreme weather. January 2024 was the hottest January on record, being 1.5 degrees higher than the pre-industrial average. And greenhouse gas emissions are the main driver of this change. If healthcare were to be considered a country, it would actually be the fifth largest emitter on Earth. And within that, surgical activity has a particularly outsized impact. For example, hysterectomies in the US have been estimated to generate over 200,000 tons of CO2 equivalent every year. And the reason we're talking about this is that per the Paris Agreement, emissions have to reach net zero by 2050 to limit global warming to at most 1.5 degrees above the pre-industrial average. So how are the emissions due to spine surgery quantified? This is done through what's called the life cycle analysis, which is in many ways analogous to what you'll have seen in economic microcosting studies. So you look at the entire patient journey, every instrument, every consumable, from the moment the constituents are dug from the ground until you put it back in during landfill, and you use that to identify carbon hotspots that you can then target with policy. So for the purpose of this paper, we considered the patient journey before the operation, intraoperatively and post. And so to reduce the impact preoperatively, the majority of interventions sort of center around reducing the need for patient travel. In 2020, during the COVID pandemic, 1/3 of orthopedic surgeons surveyed worldwide were conducting the majority of their appointments virtually. There's no need to return to in-person appointments now. In many cases, there's evidence suggesting diagnostic parity between in-person and virtual appointments as well. Patient education can also frequently be conducted virtually. The European Spine Society website has treatment-specific information for patients in numerous languages. And a lot of the preventive advice that would be espoused by spine surgeons aligns with environmental interests. So when you advocate that a patient walks, runs, or cycles to work or to the appointment, you can leverage both benefits in terms of their back pain, disc degeneration, but also environmentally. Intraoperatively, there's a number of life cycle analyses that have looked at this area. Generally, the two largest contributors are found to be both procurement and energy use. We think it's useful to think of procurement as being both the sum of production and disposal. And when trying to think about how to reduce its impact, generally, you can reduce the burden of production by using fewer things. An example of that's the second point. Investigations suggest that during laparoscopic hysterectomy, where surgeons preferentially choose fewer instruments and then also choose reusable alternatives, the intraoperative carbon burden can be reduced by up to 70%. Unfortunately, evidence specific to spine surgery in this regard is limited, but a 2020 life cycle analysis counterintuitively found single-level vertebral fusion was more environmentally friendly when single-use instruments were used. We note, however, that this was funded by the single-use instrument manufacturer and was performed in Germany. In the year 2020, 1/3 of all their electricity was funded through the burning of coal, which is unusually high by European standards. If you go through their data and you were then to make the assumption that in future this might be reduced through renewables, the burden of steam sterilization, which was used to reconstitute the reusable alternatives, had it been negated, the reusable set would have eclipsed the disposable. So this is the other face of procurement. This is waste. That's a very typical image during spine surgery. There's a lot of disposable equipment there, and much of it can be recycled. There was first suggested in 1992 that 3/4 of surgical waste can be avoided by accurate recycling. This has been repeated numerous times since. This is another example here. The evidence suggests that there's significant variation between practitioners in terms of their instrument use, even for the same surgery. This is often as a result of what's called custom packs, where everything you might possibly use during a given surgery are put into one sterile pack that is then unsterilized, and much of it goes unused. So up to 41% of instruments are unused during surgery, and by eliminating those from the custom packs, you can save 8 kilos of waste per operation. Another example, the UCLA Medical Center swapped to reusable gowns in 2012 and have saved over 300 tons of waste from landfill. And notably, there's sort of lingering concerns about an increased rate of surgical site infection, but we can't find any evidence to substantiate that during spine surgery. So energy consumption is the other main driver of emissions during a procedure. This is highly variable depending on the carbon intensity of whatever you choose to burn, essentially. So if you're burning coal, you'll be closer to the 84% of on-site emissions. If you're using renewables, you'll be closer to 17%. This is nearly all produced during heating, ventilation and air conditioning, and has been meaningfully reduced in life cycle analyses by using occupancy sensors within the operating room or reducing the temperature of the hospital by even just a couple of degrees. Then post-operatively, again, the main driver of emissions remains procurement, particularly of medicines. When looking at the UK's National Health Service, a quarter of all emissions are generated during the manufacture and transport of medicines. And for the surgeon, the most impactful thing you can likely do at this point is implement change that might reduce length of stay for patients. So in conclusion, the climate crisis is now more obvious than ever in our day-to-day lives. Healthcare, and particularly surgery and spine procedures within that, likely have an outsized role. However, no rigorous life cycle analysis has yet been performed. However, in the interim, the carbon-conscious surgeon can look to make changes that improve the efficiency of procurement, reduce the need for waste and accurate disposal. And just as an aside, for what could I do tomorrow, reusable instruments and equipment are safe for patients and environmentally beneficial. So thank you very much for listening.